Hello. Welcome to the Cognitive Behavior Center. I'm the doctor who will be taking care of you today. And you've been here before? I thought I recognized you. Can you confirm your date of birth? Thank you. And you're coming in for another cognition test. Any reason? Okay. Yeah, just a checkup is fine. It's always good to come in and get everything checked out, even if you haven't had any symptoms. So no problem. Can you confirm your home address for me? Okay, so nothing's changed. Has your insurance changed? Okay, good. And then any new medical issues? Okay, when was that? Okay. And then any new prescriptions that you're taking? How often? Okay, perfect. Okay, and you said you have not had any signs of cognitive impairment. Okay, so just a checkup. Okay, then we can get started. So you can just sit back and relax. I'm sure you remember the last time you were here, hopefully. But really all I'm going to do is ask a series of different questions. Some things are a little bit more engaging than others. They're not meant to be super challenging. They're meant to be on the easy side. So if you struggle with any of them, just let me know, okay? So let's start off with, can you tell me what today's date is? Good. And where are you? Good. Alright, now listen carefully. So I'm going to say 3 words, and I'm going to have you say them back to me, but I want you to say them backwards, okay? So the opposite order of what I tell you. So here's the first set. Banana, river, garden. Can you repeat them? Good. Now the next set, mountain, kitchen, dog. Can you say them back? Very good. And now the last set. Chair, sunrise, purple. Can you repeat them? Good. Alright, so now I'm going to show you 3 photos. I just want you to try to remember them for later on in this exam. So here's the first photo. Okay. And here is the second. And now here is the third. Okay, got it? Perfect. So just keep those in your mind for a little while, and we'll come back to them. Alright, so I think I'm going to have you draw a clock for me, and I want you to put all of the numbers exactly where they should be placed, and then set the clock to 9:30. Okay? So I'm going to give you this paper and a pencil. There you go. And I'll just review my notes here while you complete that. If you have any issues, just let me know. Alright, perfect. Yep. So you did a good job. Set it at 9:30. Perfect. Now this might be a tricky question, but can you recall any of the words you repeated back to me in the first question I asked you? Remember, it was the set of 3 words at a time. Wow, very impressive. Wonderful. Okay. Alright, next. I'm just going to give you some words, and I'd like you to spell them backwards for me. First word is cat. Good. Second word is banana. Good. Third word is happy. Fourth word is pizza. Good. And the fifth word is doctor. Very good. Alright, so this next test you might remember from the last exam you had. Basically, just going to pick a few cards out of this deck of cards and have you repeat them back to me, okay? So let's do this one, and this one. So we're just testing your memory. Alright. Card number 1. Card number 2. And card number 3. Can you repeat them back? Very good. I'm going to do another set, but this time we'll do 4 cards. This one. Okay. Ready? Card number 1. Card number 2. Card number 3. Card number 4. Okay. Can you repeat them back? Perfect. Okay. And did you have any difficulty with that? Okay, very good. So now I'm going to count in a pattern, and I want you to tell me what number would likely be next. set of names. Which one doesn't belong? Abraham Lincoln, George Washington, Tom Hanks. Very good. Alright, so now I'd like you to use a word that describes the weather outside today. Very good. Yeah, it definitely does feel a lot colder outside today. Now going back to those 3 images I showed you on the phone, do you remember what they were? Good, yeah. So the McDonald's sign, a car, and Sonic. Very good. Alright, can you put your right hand on your left elbow for me? Good. Now your left hand on your right elbow. Good. Now can you touch my left hand with your right hand? Good. Now touch my right hand with your left hand. Now, can you tell me the relationship between these items? So the first set is kiwi, orange, strawberry. Good. Train, bicycle, car. Good. Happy, angry, sad. Good. Pen, pencil, marker. Very good. Okay. Now, just a few math questions. 8 times 2. 9 plus 12. 12 minus 5. 9 times 3. 16 plus 13. Wonderful. Okay. So now 2 things I'd like to do in this little booklet I have. So here's the first page. Just want you to look closely. Can you tell me what object is larger? This or this? Good. How about this or this? Good. How about this or this? Good. Okay. Can you tell me what this color is? What about this color? This one? And this one? Alright, and now for this one. So as you can see, it's just a tracing exercise. So you just need to trace one of the characters to their matching object. So let me show you one for an example. So if I was doing this for Mario, go like this, just like that. And then if I was doing it for Peach, go like this. Okay, so I'd like you to trace Luigi for me. to the matching object, and I'm just going to watch you. So here's a pencil. Okay, go ahead. Perfect. Very good job. Any trouble with that? Any confusion? Okay. Just one more thing. So this last thing I'd like you to do is just connect the dots. So like when you were a kid, just want you to start at number 1 and then go all the way around until you reach the end number. If you have any trouble, let me know, but I think you'll be fine. So here's the booklet again. I'm just going to take a few notes while you complete that. All set? Perfect. So let's take a look. Very good. So you did a very nice job. It looks like it came out to be KK Slider from Animal Crossing. Very good. So I think that is all for this booklet, as well as the exam. So your cognitive abilities are functioning wonderfully. I do not have any concerns at all at this time. Now just a reminder, symptoms of cognitive impairment would be things like repeating numbers, forgetting items that I showed you, not understanding some questions I asked you, or just struggling in day-to-day life with simple things. So if you were to develop any of those symptoms, I want you to come in immediately. And I know that cognitive issues do run in your family, so that's good that you are coming in early to be preventative. And you can really come in whenever you want, it's your choice. Unless, of course, you do have symptoms like I mentioned, then I would want you to come in right away. And just again, any trouble remembering, concentrating, understanding, all things like that. And I also suggest keeping a daily log if you'd like. That can be helpful for people just to see if there's any patterns. For example, if you forget something a few times within a 1-week period, maybe that's something you'd want to be evaluated for. Or also have your family members and friends be on the lookout for signs and symptoms as well. Okay. Any questions for me? Wonderful. Well, all of this will be on file, of course, with your previous tests. So any questions, just give us a call. Any concerns, we are here for you. So thank you so much for choosing me as your doctor. And I wish you all the best and take care. Good morning. I'm Nurse Kay. How are you feeling? A little bit better? Good. Well, I'm glad to hear that. Have you had any sleep? A little bit? Okay. And I see you are here due to an accident. Okay, and it's just a wound on your face. Okay. How's it feeling right now? A little painful. Well, your medicine likely wore off, so we'll get you some more. So, what is the last thing you ate? Okay. And has the medication that we've been giving you, has it helped? Okay. Good. continue with that dosage. Alright. So I'm going to do a full body checkup. This is standard procedure while you're recovering. So I'll start off with your vital signs and then go through the rest of the exam. And you just let me know if you have any pain at all throughout, okay? Alright. So let's start off taking your temperature first. Have you had a temperature at all over the past few days? Going to stick this under your tongue. Very good. And just give it a few seconds. I'm glad you haven't had a fever. And you don't look flushed. So I'm thinking it'll be normal. Let's see. Yeah. No fever. So very good news. So I just need you to take deep breaths for me, okay? Alright. So deep breath. Good. Deep breath. Good. Deep breath. Good. And deep. And do you have a history of high blood pressure? You don't? Okay. I'm just going to have you put this on your arm. Very good. Yeah, right through there. So I'm just going to have you relax your arm. Set that right there. So just going to get your blood pressure. So just relax, okay? And just uncross your feet for me. Perfect. Okay. Alright, so your blood pressure is completely normal. So, no concerns with your vitals. And just real quick, a few eye tests, okay? So can you cover your left eye for me? Perfect. Read this line. Can you read this one? Alright, pretty close. Good enough. Now, can you cover your right eye? Read this one. Good. This one. Good. This one. Good. That one. Close enough. Very good. Now I'm going to test your peripheral vision. So can you just look at my nose and tell me what numbers you see on my fingers, okay? So just eyes on my nose. Good. 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 Okay. Let's take a look at your pupils. And have you ever had any eye issues, dry eyes? Do you wear glasses? Okay. Okay, what about any retina problems? Okay. Good to know. So just look straight ahead. And just going to test Now, can you cover one eye? Actually, I can help you this time. Just place this over your eye. Is that okay? I need you to tell me when you see a light in your field of vision. Okay. Good. 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 Now let's test the other eye. Okay. Good. 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 So now I'd just like to take a look at your ears. Alright? So I'm just going to come up closer and take a look. Okay. So, see any pain in your ears? No. Good. Look on this side. I'm just going to come around. Any pain? Discomfort? Okay. Very good. And your ears actually look very clean, so no discharge and very little earwax. So just 2 quick hearing tests now. Just want to make sure nothing has been affected there. So first things first, I'm just going to strike this tuning fork. I need you to tell me if you hear the vibration on your left or right side. Okay. Alright, so close your eyes. Good. And one more. Perfect. Now, I'm just going to do a light tapping sound. So again, I want you to tell me if you hear it on your left side or right side. Alright? Here we go. Good. 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 I'm just going to take a few notes to catch up on what we've done so far. So, ears, eyes. Okay. So next I will do, let me just take a look at your mouth and also just do a quick taste test. Can you open wide? Good. Just gonna look at your teeth. Can you smile? Good. Can you lift up your tongue? Perfect. And open wide and say, ah. Good. Okay. Everything looks good. Now I'm just going to do a quick taste test. No allergies, right? Okay. I'm just going to place this piece of candy on your tongue. And I just need you to tell me the flavor. And you can spit it out when you're done, or you can eat it. It's up to you. Alright? So here it is. And you know the flavor. Perfect. Yeah, it's watermelon. And no issues with your sense of smell. Okay. I'm going to do a brief test. sure your senses are working. So for this, I'm just going to place the scent right under your nose. So deep breath in. What do you think it is? Very good. It is coffee scented. And that's a tricky one to get, so good job. Now I'm going to do a few tests on your body, okay? Is that okay? Alright. So the first thing I'm going to do is just feel your legs and your abdomen. Make sure there's no pain, okay? I'm just going to lift this up. Just tell me if you feel any pain. All good. Okay. Good. And now your abdomen. No pain. Good. Now I'm going to do something just to test your sensation. Just going to take this cotton swab and gently brush it against your legs, okay? When you feel it, just say yes, okay? Alright, here we go. Good. A similar test, but this one will be on your face. Going to do a sharp or dull test. Dull, sharp. You just tell me what you feel. So close your eyes. Good. Dull. Dull, sharp, 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 dull, sharp, 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 dull, dull. I'm just going to do one more, kind of similar again, but it is using these water globes. So, you're just going to feel a little bit of a cold sensation when I place them on your body. So when you feel it, just say cold for me, okay? I'm going to place it on your face and then your arms. Cold. 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 And I'm just going to do it on your legs as well. Okay? So, same thing. just say cold when you feel it. Cold, 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 cold. Okay. Very, very good. And are you comfortable? Okay. Just making sure. So I think we're done with all of the tests. I'm just going to change your dressing on your wound and then give you some more medication. Okay. And I see your old dressing fell off, so perfect timing. So let's get everything we need. On some hand sanitizer, of course. And then I will start. First, I'm just going to touch it and check for any infection. Okay. It does look much better than what it was previously, so that's good. So let me just take a quick look. Stitches are healing nicely. Just see the little bit of bruising and redness right there. But overall, looking pretty good. Okay. So I'm going to apply some alcohol first. And of course it might burn a little bit, but it'll be over quickly. So just placing that on. And then I'm going to apply an ointment. And that will help with scarring and healing, of course. Okay. So now the ointment. And when you leave, the doctor will give you some of this as well. Probably have you put it on maybe twice a day. And it will really help. So let's put this on next. And that should actually have a nice cooling sensation. How's that feel? Good. Okay. Just gonna rub it in a little bit more. Okay. Very good. Now let's get a bandage. So I'm just going to place it kind of diagonal so we don't pull on the stitches. So I'm just going to place it kind of diagonal so we don't pull on the stitches. Okay. Just going to put it right there. Okay, perfect. And just gonna press it in. Just gonna press it into your skin. Perfect. Now I'm just going to wrap it. And I'll come back in and change this probably later this evening. How's that feel? Good? Okay. Yeah, it does look good. Alright, so let me get you your medication. And again with the medication, I'm going to give you the same dose for now. But if you feel like you need more throughout the day, just let me or one of the other nurses know. So here it is. And there are 4 pills in here, alright? There's some water next to your bed. And I'm just going to have you wait to take it until after you had some breakfast. Okay. And speaking of, what would you like me to order you for breakfast? Toast? Okay. Would you like white, wheat, or rye bread? Alright. With butter. What about any jam? And then some eggs. And how would you like them cooked? And then any juice? So, I will put that in for you. Should probably be brought up in about 30 minutes. Okay? Alright. Well, you're all set. Going to give these notes to the doctor, and I'm so happy I was able to check on you this morning. I'll be back later today, so just keep resting. If you need anything, just let me know. Okay. Sweet dreams. Hello. It's so nice to meet you. I'm Dr. K, and I'll be giving you your cranial nerve exam today. How are you doing? Good, good. I see you were referred because of an accident you had? Yeah. Well, I'm glad to hear you're doing a little bit better. Let's just see. Have your date of birth. Can you confirm your street address for me? Okay. So before we get started, I do just have some questions for you, just to make sure we have all of the up-to-date information. So first of all, can you just remind me where you actually hit your head? Okay, so right there. And it's still a little bit sore. Okay. I do see a note though that it has been healing well from your primary, so that's good to hear. So first things first, your medical history. Any issues that you've had in the past? Any issues that run in your family? Okay, and when was that? Okay. 2 years. Okay. Any allergies? Good. History of high blood pressure? And what about the current medications that you're taking daily? And how long have you been taking that? Okay. Yeah, that's fine. I'm just marking all of this down, just so we're aware, especially if we find something concerning. Okay. So have you had any of the following symptoms since the accident? Headaches, blurry vision, fatigue, numbness or a tingling sensation? Fever? Any weakness? Any forgetfulness? Okay. And then what about your vision? Do you wear glasses, contacts? Usually 20/20 vision. Okay, good. Perfect. This is what I need to get started then. So, have you had a cranial nerve exam? Okay. So just a reminder, it's an exam to really test your senses. And since you hit your head, we want to make sure everything is working properly. So I'll be testing your vision, your hearing, your smell, your taste, and a few other things. And if you feel any pain or if anything's bothering you, just let me know and we'll stop right away. But really, it's kind of just a usual exam. So you shouldn't be worried at all. I'm just going to start off putting some hand sanitizer on. Do you live in the neighborhood? Okay. Yeah, your address looked a little bit familiar. I just moved here about a year ago, and I've only been at this practice for a few months, so. Have you been sick recently? Okay. And how long were you sick for? Okay, well good, I'm glad you're feeling better. So let's just take your temperature, and I'm just going to have you put this under your tongue. Perfect. And let's see here. Okay, 98.6. Let's check your heart and then your lungs. So, for your heart, I'm just going to need you to relax and breathe normally, okay? Just going to put this on your chest. Just breathe normally for me, okay? Good. Keep breathing. Good. Good. Now I'm going to check your lungs, so I need you to take a deep breath in when I say, okay? Alright. So, deep breath. Good. Deep breath. Good. Deep breath. Let me just check your back. Deep breath. And deep breath. Okay. So everything's normal. Your heart. And your lungs. Let's move on to your optic nerves, your eyes. So I'll be testing your visual acuity, your sight, and your field of vision. Alright? Normal tests, things that I'm sure you've had many times before. And when's the last time you went to the eye doctor? About a year? Well, I'll do a brief exam here, but I definitely suggest you make an appointment soon for a more thorough exam. So I'm just going to start off by showing you this chart. And I'm going to have you cover your right eye for me. And can you read this line? Good. Now this one. Good. This one. Okay. Little trouble. Move it back a little bit more. Can you read this one again? This one. This one. Okay. So definitely trouble. Can you cover your left eye for me now? And we're going to start up close again. This line. This one. Good. This one. Okay. Move it back. And this one. Good. This one. Good. This one. Okay. So those lines are a little bit more blurry for you on the bottom. Okay. Can you tell me what this color is? This one. Okay. Just take some notes here. And have you ever worn glasses? I know you said you usually have 20/20 vision. Obviously, our eyes change with time, so it may be possible that you need a light prescription. But let's test your eyes in a few other ways. So I'm going to be taking a look at your pupils to make sure they are contracting and dilating as they should be. So can you just look directly at my nose for me? Good. Just keep looking at my nose. Very good. Very good. Okay. So next I'm just going to have you follow this light just with your eyes, alright? So just don't move your head. And here we go. Very good. Now I'm just going to move it in another pattern. And just keep following. Very good. Okay. Perfect. So I'm going to feel your face. Is that okay? Okay. I'm just going to palpate it. And I need you to just tell me if anything hurts. Anything on your cheeks, your forehead. So no pain. Okay. And do you usually ice it, or what have you been doing? Okay. Alright. you still do that. I did notice a little bit of bruising, which hopefully will go away soon. It can take some time though, so you just have to be patient. So next is the sharp and dull test. So I'm going to put 2 different sensations on your face. The first will be just a light prick, like this, okay? It doesn't hurt. And then the other sensation will be just a soft touch with this makeup brush. So one will be more sharp, one will be more dull. So you just tell me what you feel, alright? So close your eyes for me and just say sharp or dull based on what you feel. Okay? So here we go. Good. 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 Now I need you to smile for me. Very, very big. Good. Now frown. Good. Just checking your face muscles. Now can you puff out your cheeks real big for me? Good. And now raise up your eyebrows. Good. So for this next one, I'm just going to take this cotton swab and very gently touch different parts of your eyelashes. Don't worry, I won't poke you in the eye. I'll be very careful. And it's just to make sure your eyes react correctly, so you should blink, okay? So you can just look that way. I'm gonna do your left eye first. Good. Good. Now look the other way. Good. 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 Alright. Perfect. And now the last face sensation test just involves some water globes. So here they are. And all I'm going to do is place them on different parts of your face. You'll feel a very cold sensation, and I want you to just tell me when you feel it. So let's begin. Good. 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 Perfect. Now if you could just lift your sleeves, I'm going to do the same thing but on your arms. Alright. Good. 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 So just a few more things. The next is testing your sense of smell. So I have 2 different things here. I just need you to tell me what scent you smell when I place it under your nose. Okay? And here is the first one. It is pumpkin. Smells delicious, right? And the next one here's the next one. So can you just tell me what that smells like? Perfect. Yes, it is lavender. And have you lost your sense of smell or taste at all previously? Alright, so just when you were sick. So taste test is next. I just have 2 different flavors, and I'm going to drop them on your tongue. And you just have to tell me the flavor. Okay. So here's the first one. Can you just open your mouth? What do you taste? Very good. Bubblegum. 2 more. Open your mouth, please. I'm just going to put 1 drop. And what do you taste? Good. Yep, grape. Not one of my favorites. And now just 1 more. So, mouth wide, 1 more time. And what's that one? Strawberry. You got it. Good job. So, no concerns with your taste or your smell. So the last thing is just checking your hearing, and it's just to make sure your hearing was not affected at all after the injury. Okay. So can you just turn your head to the side a little bit? Perfect. Just gonna take a look. No pain around your ears, right? Okay, good. And now turn your head the other way. No pain in this one. Okay. And when's the last time you had an ear cleaning? Okay, so quite a while. Do you usually go once a year or when you feel like you need it? Yeah, I would definitely suggest you do that. I think that's one thing a lot of us forget to do, but ears do build up and it can affect our hearing, so let's do a quick test. All I'm going to do is just whisper some numbers and I'm going to have you repeat them. Alright? 1, 15, 25. Good. 7, 14, 32. Good. 99, 41, 66, feel like you struggled at all? It didn't seem like it. Okay. I'm not going to do the tuning fork test then and some other tests. I feel like you're fine. But obviously, if your hearing was to get a little bit disrupted, always make sure you go get it checked out. Alright? So let's look at the results here. Like I said, the only thing I'm concerned about is that eye test. So, do you have an eye doctor you go to? Okay. I would make an appointment as soon as possible. Are you on a computer all day? Okay. So, that's a part of your job? Okay. Yeah, I just don't want you to have to strain when you're looking at a computer or just have anything get worse, so I'd have you do that. And besides that, just rest and recover. Your bump should be going away soon, and if anything changes, let me know. And I do want you to come back actually about 1 month from now. We're going to do another cranial nerve exam just to make sure again nothing's changed. It is a big deal when you bump your head, so we need to make sure everything stays as is. So you just work on getting some good rest so you can recover quickly. And I'm very glad you are doing well. Alright? And I will pass these notes along to your primary care physician as well. So, thanks so much for coming in. It was so nice to meet you. And I'll see you again in 1 month. My colleague at the front desk can make that appointment for you. Alright? Well, take care, and I'll see you again next time. Hi! It's so great to meet you. I'm the student nurse who will be examining you today, and you're just here for a checkup, right? Perfect. Well, I really appreciate you allowing me to do this exam. So I do need a few pieces of information. So I know your name, but can you confirm your date of birth? Okay. And any current medical issues? And what about any past medical issues that you've dealt with? Okay. And when was your last checkup? And then are there any medical issues that run in your family? Okay. Let's see. Then what is your diet like? Okay, so what about fruits, vegetables? Do you drink caffeine? Okay. Do you have a history of high blood pressure? Good. And have you been sick recently? Okay. Good. So I think we can get started. So I'll start by taking your vital signs. And let's do your temperature first. So that'll be simple. Just need you to put this thermometer under your tongue. So just open wide. Very good. Just put it right under your tongue. Perfect. And just keep your mouth closed tight. Good. Should be all the way under your tongue. Okay, and then I'm just going to wait for it to go off. Okay, let's see. Okay, so your temperature is normal. And that makes sense since you are not feeling sick. Just going to take a note of that. And I will be taking a little bit more notes than you might be used to, since again I'm practicing. Sure. So let's see, next I will do your heartbeat. So I'm just going to get my stethoscope and just going to ask you to take a deep breath and then hold it for me, okay? I'm going to put this on your neck. Okay. So, deep breath in. Good. And one more. Good. Then deep breath in. Good. I'm just going to put this on your chest. Deep breath. You can let it out like normal. Yeah. Good. Deep breath. Good. And one more. Good. Okay. So I didn't hear anything abnormal with your heart. And you said that heart issues don't run in your family, right? Okay, good. So I'm going to move on to the blood pressure. Do you have an arm that you prefer me to do it on? Okay. So I will do your left then. Okay. Just going to ask you to slide your arm right through here. Perfect. And then you can just relax your arm. I'm just going to stick this part right underneath. Okay. And now this will just get pretty tight on your arm. And then I will release it. Alright? Okay. Perfect. So you can take your arm right out. Over here. So your blood pressure is 120/80, which is normal. And again, high blood pressure doesn't run in your family. Okay. So let me put heartbeat normal and blood pressure 120/80. So let's see what's next. Guess I will examine your head next. So first, I'm going to just use my flashlight here. Just going to take a look at your skin. So you can just look straight ahead at me. Perfect. And let's see. How often do you go to a dermatologist? Okay. Yeah, your skin looks pretty good. No bumps, nothing painful recently. Okay. Yeah, I don't see any abnormalities, so that's good. Just notice you have a little dry skin. Is that normal? Yeah, I mean it is winter, so check for any drooping or any pain on your face. Can I touch your face? Okay. Just gonna gently touch. I don't see any drooping and any pain on the side. A little jaw pain. So that can be caused by TMJ. Do you grind your teeth? Yeah, so do I. Have you talked to a dentist about it? Okay. Yeah, I know sometimes you can get a retainer to help, but sometimes they don't work. If you need more advice, I can definitely write you a referral. One of my friends is an oral surgeon and can definitely help with those issues if you need it. Okay? So just open your mouth for me wide. Good. Now close it. Good. Now can you open one more time? Look at your throat. Okay. Lift your tongue. Say ah for me. Good. Okay. And I just want to feel your lymph nodes for any inflammation. Okay. All feels good and no pain again. Good. Okay. So, just take a few notes. And then I'm going to do a quick eye exam, not a full eye exam that you would have with an optometrist, but just checking a few things. Do you wear glasses? Okay, contacts. Alright. So let's start off by checking your pupils. I'm just going to dim the lights a little bit, okay? So just look straight at me, right at my nose. Good. And I'm just going to make sure your pupils react to light as they should. Okay. And you can keep blinking, that's fine. Okay. Now can you just follow the light for me? Very good. Perfect. Now for your peripheral vision, I think. Let me make sure. And am I doing a good job so far? Okay, good. Just checking, I am a little bit nervous. I think it definitely takes some time to feel confident. But I'm sure after doing many of these exams, I'll feel better. Okay, so your peripheral vision. So you're going to look directly at my nose again, and then just tell me how many fingers I'm holding up, okay? Here we go. Good. 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 I'm gonna have you cover your right eye first. Good. And hold this right here and ask you to read this line for me. this one? Very good. And then what about this one? Very good. And let's switch and cover your left eye for me. And read this line. Good. This one. Good. This one. Good. This one. Good. Okay. Do you typically have dry eyes in winter? Yeah. Okay, I might give you some drops just to take home if you want to use them. They'll be really helpful for bedtime when you sleep. Kind of make your eyes feel refreshed when you wake up, so just make a note of that so I don't forget. So eyesight 20/20, pupils good, peripheral vision great. Dry eyes. So now I'm going to check your reflexes. So can you just stick your arms out for me? Good. Then I'm just going to push down and I need you to resist. Okay? Push, 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 push. Okay, good. And then I'm also going to push on your legs. So just resist for me. Push, push, push. Okay, good. Good job. Now, can you tilt your head back for me? Yep. And now tilt it forward. Good. And then right. Good. And then left. Good. Okay. No pain. Okay, what about when I was pushing down on your legs and arms? No pain. Okay. I forgot to ask you about your fitness. So, do you exercise a lot? Okay. Okay, that's pretty good. What do you do for work? Okay, so you are moving around a little bit. That's good. So, just two more things. I guess let me first check your abdomen. So I'm going to have you lean back a little bit. Good. And then I'm just going to push on your abdomen and kind of do a light tap. I just need you to tell me if you feel any pain at all, okay? Alright, so let me start on this side. Any pain? Good. Okay, and now to this side. Any pain? Okay. Yeah, usually if a patient does have pain, they will jump, or I can tell if they have discomfort, but I always ask just to make sure. So, abdomen. And the last thing I'm going to check is your ears. Again, not a full exam. Just want to take a look inside. I actually forgot to ask about your ears. So, do you ever have trouble hearing? Okay. And have you ever had your ears cleaned? Okay. Yeah, that's fine. Not everybody gets that done, but definitely something to think about. So I'm just getting my otoscope ready. And all that is this right here. It will allow me to see your eardrum, make sure there's nothing going shouldn't be. So, can you just tilt your head for me? Good. Just gonna take a look first in this ear. Looking for redness, any inflammation. Okay, it looks good. And tilt your head again. Okay. Okay, no redness, no inflammation. Eardrum looks good. I do see a bit of wax, but nothing too crazy. So yeah, I can actually ask the doctor for a recommendation. I think it might be best to maybe get your ears cleaned. Nothing that needs done right away, but it might be a good idea for the future, like I said. So I'm making a note for the doctor there. And then just one more thing. So I'm going to assess your cranial nerve 8. So I'm going to have you cover one ear. You pick whichever one you want. And then I'm just going to whisper a few numbers on one side at a time. And you just tell me what they are. Okay? Okay, so let's begin. 13, 45, 22. Good. 8, 17, 34. Okay, good. So now I'm just going to do this side. 55, 6, 81. Good. 99, 13, 42. Okay, good. So, did you struggle at all? It didn't seem like it, so I think you're good with your hearing. Although, of course, we would suggest that you get a full hearing exam once a year. Let me just make sure I've checked everything. So, your ears are good. Perfect. And, the dry eyes. So, let me see here. I know I have some. Here it is. Okay, so this is what I use. And I think the doctor would probably suggest this as well. So this is a night gel, comforting dry eye relief. And let's see the directions. Put 1 or 2 drops in the affected eyes as needed. So I usually just put 2 drops on the lower part of my eye right before bed. I will say it feels a little bit odd since they're gel-like, but they really help me sleep with dry eyes. I used to wake up in the middle of the night and feel kind of itchy and irritated, so here they are. Okay. And I think we are all set. Now, do you have any questions for me? Okay, good. So I'm going to speak with the doctor right after this to just give my notes, and if he has any questions or needs information from you, he may reach out with a phone call. I'm glad you are in great health, and you can check out at the front desk. Alright, well, take care and be safe.